Good afternoon. So I'll be discussing some unusual or let's say unexpected side effects of COVID pandemic that we are seeing in children. And I thought that they were much more serious and we should kind of focus on them. So, when COVID started, so UNICEF stated right from the beginning that we all know that COVID is very milder in children. However, the children are the biggest victim of COVID. And why is that? And UNICEF recognized that way back in March 2020, that whole ecosystem of childhood changes because of COVID. So we have been seeing severe vitamin D deficiency in adolescents and even normal children, and excessive weight gain in preschool or school children, maybe 10-12 kgs in last 1 year. Children from 6 to 9 years have gained. But I'm not going to discuss about that. I'm going to discuss something more. And this 26-month-old child came to me for routine pediatric consultation. And they told, like many of these patients are telling us now, that we have taken out our child for the first time in last 12 months. And when I went through, nearly 8 vaccinations were pending. The question was not that. When we were interacting with the parents, we realized that the child was continuously watching mobile and continuously seeing YouTube. And then direct questioning, they said that's the only way to keep the child quiet. And then we realized that child just doesn't interact with any of the commands. He has no eye contact. And when we asked, mother said, no, he is very clever. He says 1 to 100 without pause, and he can say all alphabets very nicely. So what is the problem? The problem is possibly communication disorder, or what we say autism spectrum disorder. And that is what I thought should be highlighted. So how does the speech and language develop in a child? So between 3 to 6 months, cooing, gurgling, babbling starts. But really, critical period of language development starts at 12 months, where the child starts having first words. And then by 18 months, usually more than 6 words, maybe up to 40 words. And by 2 years, they start having 3-word sentences. This period is vulnerable. So we should know how a child learns to communicate or learns to speak. So naturally, child has to first hear. Only when the child has intact hearing, the child can speak. Then he has to have good cognition. He should comprehend. He should acquire what is learned, what he has heard. And these 2 steps are important. But what is really most important step in child having communication is child having communication skills, that he should communicate. Someone must communicate with him. And you must realize that once the parents start communicating or the child starts communicating with the child, there is a feedback mechanism. Okay, here, and the child listens and starts the speech development occurs rapidly. And therefore, language development or communication skills is more experience dependent. If the child doesn't experience something, they will not learn to communicate. And what is happening in COVID now, that what a change in COVID, that there is social isolation. For children, there are no schools, there are no nurseries, there are no plays, there are no childcare centers because of social isolation. Both the parents are working from home, often so busy that at least before, when they would come back from office, they would give some time to their child. Now they are working overtime, and most of the times, the only way to keep the child out of the way is to give him mobile or some screens. And the worst is smartphones, not so smart. And then there is no two-way communication, very less interaction with parents. And that is what results in autism spectrum disorder. So we have been actually, after the opening out, are seeing 2 or 3 children with suspected autism spectrum disorder, where almost every day, and that's a huge number. Some of this must be a tanked up effect. That means they could have shown us during the lockdown, they didn't come and now coming, but really it's a huge problem. And how does screen affect speech? That language development, increased screen time is linked to delayed language acquisition and academic challenges. It is also known to have cognitive problem, leads to hyperactivity, impulsivity, and again, that's not unusual. In fact, I remember even before COVID time, once Mugdha said that most of the parents and the children waiting in pediatric OPD are hooked on mobile phone. They just want to that's the thing. And of course, they have motor and physical problems. So what is basically autism spectrum disorder? What are the symptoms? Regression of speech. This particular index child that I saw at 26 months of age was already speaking 3 to 4 words before the COVID lockdown started. He was speaking 3 to 4 words, then slowly he started going into his own self, so to say, and then stopped communicating, stopped having any interaction. And it is decrease in social interaction. So what does that mean? What are the signs of decrease in social interaction? There is low or less eye contact. See, when I'm speaking, most of you, we are kind of looking at each other's face and there is eye contact. In a child with autism spectrum disorder, they just try to avoid eye contact totally. There is no pointing of the objects. When the child needs something, he would take the caretaker, mother or father, with him, so to say, glass of water, rather than point and saying, give me that glass of water. So there is no pointing at all. And there is no joint attention. That means if we want to show, see that picture there, see how that fan is moving, the child will not look. So both parents and child cannot jointly focus their attention to something. And this is called, so these are non-verbal communication skills the child loses first, and then the communication skills. The child may be able to count numbers and alphabets and maybe saying nursery rhymes very nicely without understanding the meaning of that. And that often fools the parents. So we must remember that speech, they have speech, but no language, and speech is not equal to language. So excessive early life exposure to screens is associated with speech and communication delay. So why this is so important? Because there is some concept of threshold for language development or critical period threshold. So that's why mother tongue is so important. That our brain plasticity, that means modulation of neural connections, they occur best till 2.5 years as far as language development is concerned. And after 2.5 years, that's once the threshold is reached, acquisition of any language skills, communication skills become extremely difficult. And we are actually seeing these children at around 24, 26 months of age, where we have hardly any time left for intervention. So it's very difficult to learn a language after 2.5, that is 30 months of age. And this is again very interesting, that what really matters is number of words spoken to a child. So when a study was done, this is not related to screens, but when the study was done from the children growing in different backgrounds, someone from both the parents highly professionals and both the parents not hooked on screens, and both the parents in working class, in a welfare, this is US study, an average number of words that a child not average, cumulative number of words that a child hears by 4 years of age are nearly 15 million in a welfare kind of low social background kind of area. Whereas in a professional families, they hear up to 50 million words. So there is a gap of 30 million words, and this gap is associated. So more the words child hears to, listens to, it is leading to better language development. And more screen time naturally means less words spoken to the child. So remember, the emphasis here is not the number of the words that the child is hearing, but the number of the words child is spoken to. When I'm seeing some video, I might be seeing hearing lot of things, but none of the words are spoken to me, and that makes a difference. So what should I do as parents? I think first and foremost, we must reduce the screen time. And I thought this is very important. And what is the AAP, American Academy of Pediatrics guidelines on screen time? That till 18 months, limit the screen times only to video chatting with adults. It seems if video chatting with adults, so they have studies from say US to Japan, and the child learns the Japanese language even on video chatting. So because child is spoken to and not only hearing, and no other screens. And I think if I roughly say what's in my percentage of practice, maybe 5 to 10% of children are only avoiding screen till 18 months of age. From 18 to 24 months, only educational videos, and not only that, educational videos watching with caretaker. So caretaker is involved. So caretaker asks, see, this is, may not be, it's a cartoon character, Chota Bheem, but this is how Chota Bheem is brave or something like that. The caretaker gives feedback to the child. That's more important than the watching the video at all. And then between 2 to 5 years, limit the non-educational screen time, because unfortunately, all schools are on the screen time, but non-educational screen time to 1 hour on weekdays and 3 hours on weekends. For other things, we should have unplugged or no screen time zones at our home, especially during meal time. And you might know that mealtime screen time is associated with obesity and increased BMI. We should have shared screen time. So having your own screen and seeing together is not a social activity. But remember, watching television together, maybe a cricket match or a nice movie together, is a family social activity that increases the social interaction and doesn't affect the child's learning much. Discuss the child about what he has or she has seen on the screen. Not so much to check about the content of the screen, but to encourage communications. Encourage books. Books are the best. And audio or do-it-yourself screen programs would be really good. So, I mean, there are few things to ponder. That whether are we making screen time as villains, and are the screen times really a cause of this language delay, or there is a kind of a real symptom of quality of parent and child interaction. So parents do not have good quality of interaction with the child, and therefore they substitute screen, and whether screen is just a confounder rather than causality, that needs to be seen. So, however, I think this is one of the last slides. You must remember that screen time affects your child's development in all fields of life: physical, cognitive, socio-economical, socio-emotional, language, and motor development. And therefore, we must know that technology is a great servant, but a terrible master. So when it takes control of your life, it's going to have a tremendous impact. I think, thank you very much.